Good morning, everyone. Good afternoon. My name is Dr. Tony Cole, and I am your presenter for today. I'd like to welcome you all to our series, Mental Health. The struggle is real, reaffirming our strengths in the Black community. This was a partnership developed with BlackDoctors.org and SAMHSA, Substance Abuse and Mental Health Services Administration. Again, my name is Dr. Tony Cole, and I serve as an adjunct professor in the Howard University School of Social Work, MSW Starship Program, and I'll also be your presenter today. I have a doctorate degree in behavioral health, and I'm also a licensed clinical social worker. We are thrilled to have you join us today as we explore the intersectionality of mental health and spirituality in the Black community. As many of us already know, discrimination in the mental health profession persists, as evidenced by how Black patients are treated in contrast to their white, non-Hispanic, white counterparts. The disparate treatment is rooted in systemic racism and provider bias. The impact of racism on mental health in the Black community often leads to poor outcomes. Blacks are often misdiagnosed or overdiagnosed with schizophrenia. They are privy to mistreatment or dehumanizing mental health services. They distrust the healthcare system that lacks culturally competent and ethnically diverse mental health professionals. So, this intersectionality of mental health and spirituality in the Black community is wrought with opportunities because spirituality often provides resilience, strength, and hope for believers. Behaviors and attitudes also needed to foster improved mental health. The role of the Black church through the years served as an anchor and a bridge for those who need to access mental health services. So we're going to go ahead and get started with this PowerPoint presentation. Again, I'd like to thank Howard University School of Social Work, Dr. Crew and Dr. Cross, who actually got the grant and the funding for this particular program. And I want to just start this presentation off with letting you know that the Black perspective is the guiding philosophy of Howard University School of Social Work, as it emphasizes the delineation of ways in which the strengths of African Americans can be used to respond to oppressive and discriminatory systems. The intersectionality of mental health, I've basically said that already, is wrought with opportunities, and that's coming from a strengths-based perspective. You know, we look at discrimination in the Black community, but then we also talk about opportunities when we bring in our spiritual practices and our spiritual traditions. So we're going to see how this, turns out. We're going to talk specifically about each. And at the end of this, hopefully practitioners who aren't necessarily familiar with treating African Americans or don't have a lot of experience, you'll walk away with some tools as well. Because when you start from a place of, we all know in social work 101, start from where the client is. And the client always brings strengths with them. And so we need to tap into those strengths. And for African Americans, a lot of times one of their primary unused or untapped resources is their spirituality. But more recently, social work assessments have started to include a person's religious or spiritual affiliations, which is a step in the right direction. So when we talk about disparities in mental health care, compared to whites, African Americans are less likely to receive guidance, consistent care. They're less frequently included in research. So and let me just put a pin in it right there. When we talk about research, the importance of research and, on the medical field and on the healthcare, um, we need to have diverse studies. We need to have diverse people participating in those studies so that we can see how these trials affect, different demographics. And if we don't have Blacks participating in some of the leading studies, then when these medications come out and these trials come out, they won't benefit us because we do respond, our bodies do respond differently to certain medications. We could think about when the medication, for people who had like cirrhosis of the liver, and a lot of the studies and the trials and the research that was done on non-Black individuals. So Black people had a hard time adjusting to some of the medications, and they didn't get the benefit of having healing with their liver and so forth. So research and trials is so important, and we need to be represented in those groups. Um, African Americans are more likely to use emergency rooms or primary care rather than mental health specialists. Compared to whites with the same symptoms, African Americans are more frequently diagnosed with schizophrenia and less frequently diagnosed with mood disorders. Now, being a healthcare professional for over 30 years, one of the things that I've come across is that when African American patients talk about their spirituality or they talk about their religious training, they'll say things like, God's going to heal me, or God told me that I'm going to be okay. Well, if they're talking to a white mental health professional who doesn't understand their faith tradition, that can be seen as psychosis. You're hearing things. How can God tell you anything? And how do you know it's God? And so when we get this overdiagnosis of schizophrenia, I'm not saying that it's all related to African American patients saying that they heard from God, but I'm sure some of that's in there. And that is, again, one of the traditions of the African American community, having that personal relationship with a God that they understand. And that can look different ways for different people. But the schizophrenia, you hear voices, you see things. Some of it also is substance-induced psychosis. A patient comes through the emergency room, as stated here, and they tripped out off some sort of drug, and they're hearing things and they're seeing things. And instead of getting diagnosed or having it ruled out, substance-induced psychosis, there's this diagnosis of schizophrenia in their medical records. So these are some of the biases and the disparities that we see in the mental health profession. Now, when we talk about barriers to mental health care, the strong Black woman. Now, these are barriers often within the Black community. The strong Black woman stigma. And let me just talk about that one for a second. Don't call me strong when I'm surviving, because what people tend to call strong is simply survival. When you don't have a choice but to keep going on day after day, despite the disparities, despite the daily challenges of life, that's just what you do. But it's almost, and we call it a stigma because it's the connotation that as a Black woman or a Black man, you don't need help. And that's where we need more sensitivity, we need more education, and we even need to learn how to start asking for help and start saying, this is too much. Can you help me? But when everyone's celebrating you because you're so strong, where do you go for help? Who do you go to? Because the same people who are telling you that you're strong probably are struggling with their own mental health issues and don't know where to go for help. But what we've learned is that generations who are college educated and so forth, they begin to have more access to mental health services, better health care, just improved access than maybe the generations before us. Because when you go back, let's just say a generation, 2 generations ago, a lot of times what was happening in the Black community stayed in the Black community. You know, so a lot of times we didn't know about Miss Johnson down the street who had a mental health breakdown, who had a mental health breakdown and had to be hospitalized. We didn't hear about those type of things. It was like a hush hush whenever mental health was discussed in the community. But now there's more awareness. We have the 988 number, we have the suicide lines and so forth, to decrease the stigma and those barriers to people who need mental health treatment. And of course, there's a mistrust in the medical community, and there's a reason for that. I was actually thinking about the report that had came out, and I'm gonna pull it up at some point. But there was a report that came out that talked about the unequal treatment, confronting racial and ethnic disparities in healthcare. And this was a landmark report that came out from the Institute of Medicine back in 2002. So you could take a look at that. But it just shattered all of the denial that people were in, that the healthcare profession was in. Like, no, we have policies and procedures and we treat all our patients the same, universal health care. But even though Black people knew, the Black community knew that there was unequal treatment. They may not have been able to verbalize it. They may not have written about it, but they felt it. And so when this report came out, this is a quote from the Institute of Medicine. The sources of these disparities are complex. They're rooted in historic and contemporary inequalities and involve many participants at several levels, including health systems, their administrative and bureaucratic processes, utilization managers, healthcare professionals, and patients. The report goes on to say that African Americans and Hispanics tend to receive a lower quality of healthcare across a range of disease areas, chronic diseases, and clinical services. African Americans are more likely than whites to receive less desirable series, such as amputation or all or part of a limb. Disparities are found even when clinical factors, such as a stage of disease presentation, comorbidities, age, and severity of disease are taken into account. Disparities are found across a range of clinical settings, including public and private hospitals, teaching and non-teaching hospitals, etc. Disparities in care are associated with higher mortality among minorities who do not receive the same services as whites. And this was a report from the Institute of Medicine. And in a nutshell, what they're saying is systemic racism is wrought throughout the healthcare industry. So when there's a mistrust in the medical community, this is the reason. And you also have to think about access or the lack thereof. And we know, based on the social determinants of health, sometimes there are barriers to access to care. The primary care provider is normally that first point of contact for any patient if they're not being seen in an emergency setting. And so now the primary care providers, they see those, they used to be missed opportunities, but now they see those as opportunities to connect, to assess those clients and connect them to the services they need. So now when you go to your primary care provider, they'll ask you, have you been suicidal in the last 30 days? Have you thought of harming yourself? Have you, they asked you questions in the past that they didn't ask. So the patient comes in for a sore thumb, they walk out suicidal, and their doctor never knew that this was the case. So we're now starting to take advantage of those particular opportunities. For some reason, my slides look incomplete. It doesn't look like I'm seeing the entire slide. Like I need to scroll down and I can't. Can I get some help with my slide presentation? And while we are doing that, yeah, so we're going to talk about, let me see, I think it came up. Yeah, I'm still not seeing the full slide for some reason. So I'll pull my slide up. And when we think, like I said, when we talk about barriers, what are those things that are in the way? What are the things that are getting in the way of us providing adequate services to our clients? That's what we need to find out. And what is it that we can do to make those changes? Thank you so much. So, also the lack of culturally competent and culturally diverse mental health professionals. That's a big one, because if you have a Black client or patient come in to see who finally get the courage or who finally understand the importance of seeing a mental health professional to get the help that they need, and they're met with someone who doesn't look like them, it's going to be hard to open up to that clinician, to be transparent, to talk about things that bother them. So having a reflection of themselves is important. Having culturally diverse mental health professionals, and if they're not diverse, at least be competent, culturally competent. At least know something about the populations that you're serving. Specifically, their spirituality. Where do they go for strength? How does that population cope with life? How does that population cope with systemic racism and cultural biases? Though we have to have the courage as clinicians to dive right in and to ask the tough questions instead of pretending as if those questions doesn't exist or if those issues don't exist. And so these are the problems, in the mental health field. Those are just some of the problems that the Black community are faced with. And when we talk about spirituality, sometimes, yes, spirituality serves as a strength, and yes, spirituality give hope and help with resilience and all of those things. But there's another aspect to it that I think deserves a little attention, and that's when a person who needs mental health services deny the benefit of seeking professional help because they believe or they've been groomed or been told that God's going to fix it. God is going to fix it. All you have to do is pray hard enough, pray long enough, and God is going to fix it. And so that's where we have a clash in interests, because depending on how they were groomed or depending on how they were raised, some people will not go against their belief system, not even for healthcare benefits, to receive healthcare benefits. And we know there are some religions, so to speak, who forbid blood transfusions, and they won't do it. There are some religions where they have to be buried within 24 hours of their death. So we get to see how much our religion and our spirituality, the significance of it and the role that it plays throughout our lives, including our healthcare and our mental health. And so what do you do as a mental health professional when you have a client who is clearly in need of mental health treatment? They've told you, I can't get out of bed. I've been in bed for the last 2 weeks. I haven't been able to groom. I haven't been to work. Everyone's calling me. They're worried about me, but I just don't have it in me to move. This client is severely depressed and they need help. But they're telling you that they spoke to their pastor, and their pastor told them that they were praying for them and that all they need to do is continue to pray. So how do we handle those scenarios? And there isn't an easy answer. There isn't an easy solution. And I think as clinicians, as mental health professionals, we have to know when some things are outside of our control, when there are some things we can't make happen. But what we can do is just provide resources and let the client know that we care and that we'll be there, but we can't override self-determination. We can't do that. So there are times when spirituality can become problematic. There are times for some patients who may need help. And here's a picture of the Black church in all its glory. And I say that because over the years, the Black church has been an anchor in the Black community. And even before it became formalized, there were all types, during slavery, there were hush harbors, places in the woods where Black people would go and get their praise on, so to speak, to have that outlet for all of the struggle they had to face during the day and during the week. And in a lot of ways, the Black church still serves that same role. So if you've ever been to a Black church, strap on your seatbelt, because somebody's going to jump up, depending on which church you go to. But it's a known fact that Black people their church experience is deeply rooted. And so you may have somebody over in the corner shouting and crying and screaming. You may have somebody to just pop out with a song, a moan, a groan. That's mental health happening in the church. That's self-care. I have to get it out. I have to, get enough of this to get me through the week to face that. So the Black church played a significant role and continues to play a significant role in the Black community, including mental health. Now we have it where a lot of pastors and spiritual leaders and faith-based organizations, they're more educated. They have the bachelor's degrees, the master's degrees, and so forth. And so they have more access to information. And so now when they bring in counselors and therapists, they're professionally trained counselors and therapists. Yes, they have that spiritual underpinning, but they also have the mental health education and knowledge that's also necessary. So a lot of times parishioners have the opportunity to get spiritual counseling, but they can also get that secular counseling as well. And if the church can't provide it, then they can be the bridge. And that's how we should see the church in the Black community, as the bridge to mental health. And one of the things that the church can do is bring more awareness. Because another issue that we see in the Black church is obesity. It's like we have our Sunday dinners, we have our pound cakes, we get our eat on too. We get our eat on. All of these different things help foster community. All of the things that help bring us together. But there's a lot of pain and suffering, whether it's post-traumatic slave disorder, whether it's depression, whatever the case may be, the Black community still suffers. And that comes out in different ways. It may come out in obesity. It may come out in substance abuse disorder. But the church serves as a light in that darkness. And what the church is beginning to see and having a better understanding of is the importance of their role. It's one thing to stand up in church every Sunday and say God is everything or God is good. But what does that look like in practical day-to-day life? That's what the parishioner needs to know. Is God still good when bad things happen to good people? Is God still good in the light of all of this police brutality? Is God still good even though all the diversity, equity, and inclusion offices are being closed? Like, where is God in all of this? And these are the conversations that the church must have the courage to discuss, because these are questions that people have. And again, depending on how you were raised in the church, you may have been raised to never to question God. Now, you may not question God, but you still have questions. So where do you take those questions? And so, again, the church can serve as a bridge to the needed mental health care that the Black community so desperately needs. Yes, there have been a lot of strides. Yes, we are resilient. and all of the other things that keep us going, that make us feel good about ourselves, that, give us enough strength to go on day by day. But there are some wounds, and I'm not even going to call them scars because they haven't healed yet. There are wounds. And so people ask, why can't you get over it? And my question is, get over what? Get over this report that just came out about in 2002 about how can you get over something that's so systemic, that's everywhere you turn? So that's why I call them wounds versus scars, because a lot of the wounds that are inflicted upon the Black community, before they can heal, they're wounded again. You see, so again, there's so much to be considered. There's so much that needs to be done. But as clinicians, we get to pull from and identify the strengths of our clients. We get to say, what do you already have in your hand that we can use? Yes, you're coming to me, you're coming to this organization, you're looking for services, but what do you already have in your hand? And sometimes they can't see it. We have to see for them. We have to identify their strengths for them. Oh, well, you're willing to get help. You're open for help. You made the effort to get help. We have to see some good in our clients, because if we can't see the good in them, then what are we doing? And so that's why Howard University School of Social Work have that focus on the Black perspective, and it's a strengths-based perspective. It's not denial. It's not pretending that problems don't exist. We're saying that in conjunction to those problems, you are. You are. And let's pull from the strengths that you have. And so I want to quickly show you all, well, before we, okay, I think I kind of got ahead of myself, as I always do, All right, so we're going to look at this statistical data. And one of the things that we know from the data is that Black people are the most spiritual group in the U.S. Most Blacks identify as Christian or Muslim. The overall suicide rate for Black or African Americans was 50% lower than that of the non-Hispanic white population in 2020. So when you get a client and you ask the question, have you been suicidal or have you ever tried? And they say, oh no, my religion, I go to hell if I do that. That's a strength. That's a strength, because what they're telling you is that because based on their belief, if they kill themselves, it's considered a sin, or it's an act that would require some sort of punishment. So we need to pay attention to what it is our clients are saying. Only 1 in 3 African Americans who need mental health treatment receives it. And then this is a really important observation here. The physician-patient communication differs for African Americans and whites. One study found that physicians were 23% more verbally dominated and engaged, and 33% less patient-centered communication with African American patients than with white patients. So just think about your experiences when you go to the doctor. How engaging is your doctor? Do you get the opportunity to ask them how their kids are and where did they go? Do you talk about vacation with your doctors, or do, your doctor come in for 3 minutes, tell you what test results are, and then fold their arms and say, do you have any questions for me? With managed healthcare, that may be more of the norm, but what we're saying here is that there is evidence that physician-patient communication differs between white and Black patients. And again, that's more of that systemic racism, that's more of that diversity, maybe the discomfort of knowing what to say. I don't know. It's not for me to necessarily figure it out, but the truth is the truth, and the research speaks for itself. These things do exist, okay? And I talked a little bit about the negative impact of religion or spirituality on mental health. Some people, some religious denominations may see mental health as demonic. You have demons, and we need to pray away those demons. We need to pray away those demons. And so when we see patients who may be same gender loving and who may be in this identity crisis because their parents took them to church and had all of these people pray over them and try to exorcise these demons from them, and it messed up their minds. Like, how do we handle those issues? Because those things are happening in the Black community. There's the belief that certain things can be prayed away. And if they can't be prayed away, they're demonic. So we know that mental illness has to do with chemical imbalances. It has nothing to do with your personal deficits or your personal inability. It has to do with a chemical imbalance. And professional help is going to be needed. So those are some of the things that we have to watch out for. And just also some of the, the phases that trend from time to time. Like now, everyone is familiar with being bipolar. Oh, she's bipolar, he's bipolar. And the more recent, she's a narcissist, he's a narcissist. And I tell my students, unless you diagnose that person, please don't walk around calling people bipolar or narcissist, because that perpetuates the stigma. Whenever someone is referred to as bipolar or narcissist, it's normally not in a positive light. It's not. So sometimes we don't understand how we can perpetuate the stigma by some of the things that we say, or some of the things that we repeat, or you hear people say cray cray. That's another slang term you'll hear in the Black community. Oh, she cray cray, he cray cray, short for crazy. So those are some of the stigmas that we really have to watch out for. And so transitioning into spirituality, time is moving really fast. Spirituality offers resilience against adversity. Again, spirituality offers resilience against adversity. It provides a framework to navigate difficult situations, offering strength and a sense of purpose in the face of discrimination and hardship. And that's good news for some people, because sometimes you need good news. And I want to show this video. I want to share a video with you. Just a little backdrop and history on the Black church. So let me share this.
Christianity and slavery were long intertwined. While masters believed that their religion could be used to pacify their slaves, African Americans transformed Christianity and created a new culture that would serve as the foundation of their freedom struggle.
The oldest independent African American denomination is the African Methodist Episcopal Church, founded in Philadelphia in 1794 by Richard Allen, the formerly enslaved Black man who purchased his own freedom.
Black religious leaders such as Reverend Allen took a strong abolitionist stance, even helping slaves escape through the Underground Railroad. During the Civil War, some served as army chaplains, and once the war ended, many mobilized Black political participation. Some even held public office.
The Black church provided leadership opportunities for men and women who, by and large, were in subservient positions in the workforce. And so all of these preachers doing work in the Black church have been critical to giving Black people a space to envision that a different world is possible.
The late 1800s saw a dramatic proliferation of Black churches, and the church remained central to Black life through the 20th century, particularly at the height of the Civil Rights Movement.
In the 1960s, the church is playing a much more overtly militant and political role in terms of trying to organize people to defeat Jim Crow, end racism, and also to promote economic equality.
The tradition of Black religious leaders shepherding the freedom struggle reached its pinnacle with the Reverend Dr. Martin Luther King Jr. Dr. King fused religion, nonviolent resistance, and the prophetic tradition to challenge Jim Crow, while invoking the musical legacy of the spirituals that enslaved African Americans had created. Today, the Black church remains a fundamentally important institution in the Black community.
The Black church has had to be everything to Black people because American society was unwilling to do so. Today, we don't need the church to do the same things for us, but do I think the church is still a relevant institution? Absolutely. It is the place that you can come and rebuild your spirit after you deal with the spiritual assault on Black life that many African Americans experience because of enduring histories of racism and discrimination.
Yeah, so is the Black church still relevant? Of course it is. Of course it is. And I want us to take a look at positive health behaviors and outcomes in the Black community when spirituality and religion is involved. There's the community building and social support that happens in the Black church. The Black church serves as a central hub for social connection, offering a supportive network and a sense of belonging, the faith-based community as a bridge to mental health services. And I think about the stories I've heard about previous generations and how Black men were called boys and Black women were called girls. But then in the church, it was Mr. So-and-so, it was Pastor this. They were given leadership roles in the church that help boost and foster self-esteem. Identity and cultural preservation, spiritual practice and traditions are deeply intertwined with Black culture, allowing for a strong sense of identity and connection to heritage. Yeah, it's like, we often talk about code switching, and how in the workplace, Black people have to code switch. But when you think of the Black church and you think of Black culture and being around people who were raised with you, there's no need to put on those masks. Though you could drop those masks and you can say it like a TI is, right? You can just drop those masks and say it like a TI is. And I think that's, personally, that's one of the things that I enjoy most about having my doctorate degree, is because I feel like I'm at a place now where I don't have to, I can say what I mean and mean what I say, however I say it. I don't have to try to speak to any specific audience or try to make someone uncomfortable or even comfortable or uncomfortable. It's just like, yes, I know what I know and I am who I am, and the both of those things collide. Both of those things make me who I am. And what would the world be if everyone can show up 100% fully themselves? 100% fully themselves. And that's the journey. That's the journey that we're all on to some degree or another. Mental health benefits. Studies indicate that strong spiritual beliefs can be associated with reduced stress, improved coping mechanisms, and lower rates of depression. So, these mental health benefits are on par with therapy, with counseling, and sometimes with medication. Not saying that the patient doesn't need all of those things, but when we talk about self-care and when we talk about overall well-being, there are a lot of tools that we're going to have to use in order to be whole. Let's move on to the next slide here. More positive outcomes. Social activism and advocacy. As we saw in the video, the Black church served as a hub for political activities back, during the civil rights movement. Hope and optimism. Religious teachings often emphasize hope for a better future, which can be particularly empowering to a community facing challenges. Positive health behaviors and outcomes. Some research suggests that spirituality can encourage healthier lifestyle choices, such as improved diet and exercise habits. It's not unusual for a church to go on a fast. It's not unusual for members of the church to go walk for cancer, or go walk for various diseases and or have health fairs and health bazaars. Like, these are all introductions and exposures in the Black community that can lead to those positive outcomes in their health. The role of faith-based organizations, again, are numerous, but in particular, when we talk about mental health, we want that role to continue to be about serving as a bridge. And I know SAMHSA is doing an amazing job with working with faith-based organizations, giving them the resources that they need to educate and bring awareness to this area of health, which is mental health. So there are a lot of partnerships that are taking place in the community at the faith-based levels, where they're saying these are opportunities for us to improve the mental health outcomes in the Black community. So work is being done. Let's move on. And so we have to talk about, I'm about to wrap up, but But we have to talk about mental health assessment tools. And as clinicians, that's very important because what are the best practices to assessing clients who from the Black community? You know, will you get the needed information if you use tools that aren't specific to that population? So when we talk about mental health assessment tools, we want to think about COPE, the COPE inventory, and that's understanding the specific coping strategies used by African Americans. And that can inform the development of culturally tailored interventions in mental health support programs. I know that there are a lot of outpatient mental health programs where the clinician go into the community, which is great because for a long time, the client had to come to the hospital. But now we've progressed to where we know we need to go to the client. We need to see how the client is living. We need to draw from their resources. What supports do they have in their community? It may not be a traditional support, such as a parent or a family member. It may be the support of the resident manager of the building they live in. Ask me how I know. I've been outside, I've been in those streets, and I've been on those intensive mental health, been a part of those programs where we had to go out into the community and assess our clients and treat them, you know, in the community. So when we find out those specific coping strategies that African Americans are using, those are the things that we want to build upon. And so when we go out in the community and we meet with their faith leaders, maybe even go to church with them on a Sunday, not only are we strengthening that relationship between the professional and the client, but we're also learning more. And we can implement that into our treatment planning. The World Health Organization Quality of Life Assessment defines quality of life as an individual's perception of their position in life in the context of the cultural and value systems in which they live and in relation to their goals. And so I love this because it's how the client perceive their quality of life. It's not for anyone else to say it's good, it's bad, or it's okay. It's for the client to say, for them to measure, for them to judge based on what their goals are, what quality of life looks like for them, and their expectations, standards, and concerns in life. So wrapping it up, I'm going to stop, but I'm not finished. I can go on and on and on and on because these are truly two topics that I'm very passionate about: mental health and spirituality. I just had a student ask me because her mom passed away the last day of class, and we spoke. I called her, we talked, and she said, "Are you a pastor?" I said, "No, but I'll pray with you if you want me to." You know, because I was raised to believe that prayer changes things. Before this session, I prayed. And after this session, I'm going to say thank you to my source, who I believe is the source from which all resources flow. So I want to thank you all for allowing me the opportunity to present to you today. Again, I want to thank Howard University School of Social Work, SAMHSA, and BlackDoctors.org. And I want to thank the audience for being here. We do have a QR code and a URL link for you to complete the survey. So please go to that this URL and this QR code and complete the survey. Thank you again for your time on today.